Ozempic, Wegovy, Mounjaro. You see the names everywhere. Friends discuss them at dinner, celebrities post before and after pictures, and pharmacies report shortages. If you are over 60 and have carried extra weight for years, it is natural to ask, is this finally my chance? Or is this too risky for me now? After 50 or 60, weight is not just about appearance. It is about painful joints, a tired heart, rising blood sugar, and independence. At the same time, older bodies are more delicate. Ozempic and Wegovy contain semaglutide. Mounjaro and Zepbound contain tirzepatide. These medicines mimic natural gut hormones. They help your body release insulin more effectively after you eat, slow how fast the stomach empties, and send strong fullness signals to the brain. People feel less hungry, fill up sooner, and often eat less without constant willpower. In clinical trials, these drugs produced large weight loss and better blood sugar, blood pressure, and cholesterol. In people with type 2 diabetes, they also reduced the risk of heart attack and stroke. Older adults were included in these studies. Many people over 65 lost weight and gained similar heart and blood sugar benefits when the medicines were prescribed and monitored carefully. For an older adult with clear obesity and conditions such as diabetes, high blood pressure, sleep apnea, or heart disease, losing 10 to 20% of body weight can mean less pain, easier walking, fewer medicines, and lower risk of serious events. For someone who has tried many structured lifestyle changes without success, these injections can feel like real help. However, older bodies bring special risks. The most common side effects are nausea, vomiting, diarrhea, constipation, and loss of appetite. A healthy 40-year-old may tolerate that. A 70-year-old with fragile kidneys, heart failure, or poor appetite may slide quickly into dehydration, low blood pressure, and hospital stays. There are also risks of gallbladder problems and rare cases of pancreatitis. These medicines are not suitable for people with certain thyroid cancers or a strong family history of those cancers. That is why a full medical review is essential before starting. Another concern in older adults is what kind of weight disappears. Fast weight loss does not remove only fat. It often takes muscle with it. Studies suggest that a noticeable share of the loss on these drugs can come from lean body mass. For someone who already has some muscle loss, that can push them toward frailty. Weak thigh and hip muscles mean slower walking, more trouble getting out of chairs, and higher fall risk. If these medicines are used after 60, they should always be paired with enough protein in the diet and simple strength or resistance exercise so the body has a reason to keep muscle. There is also the question of what happens when people stop. Many users regain much of the lost weight within a year or so. Once injections stop, appetite rises again, and the old biology pushes weight back up. For many patients, these are long-term treatments for a chronic condition, not short-term boosters. The drugs are weekly injections, they are expensive, and insurance coverage is uneven. Some people look for cheaper, compounded versions, but medical organizations warn that the dose and purity of those products are not guaranteed. For older adults, that risk is not worth it. So, how do you decide whether this path fits you? This is never a decision to make based on advertisements or a friend's story. It should come from a careful conversation with a clinician who understands both obesity treatment and the needs of older adults. Together, you should review your weight, blood sugar, blood pressure, cholesterol, heart and kidney function, current medicines, fall risk, muscle strength, and personal goals. For some with mild extra weight and no major health problems, the risks and costs will outweigh the benefits. For others with clear obesity and serious complications, medicine may be a reasonable next step after real efforts with food and activity. If you and your doctor decide to try an Ozempic-style medication, the rules are simple. Aim for slow, steady loss, not the fastest number on the scale. Build each meal around protein and fiber. Add strength exercises 2 or 3 times per week if your joints and heart allow it. Have regular blood tests, and call promptly if you have severe stomach pain, repeated vomiting, or cannot keep fluids down. Above all, remember that no injection replaces the basics. These drugs work best on top of healthier eating, regular movement, good sleep, and support for emotional eating, not instead of those things. The goal is a longer, safer, more comfortable life in the body you have now.